Hi.
We're back.
So apparently the first time we attempted to do this lovely talk on managing back to school anxiety, there was no sound. So, generally speaking, I don't know how you feel, but that's usually less helpful to other people. So we thought we might restart. And you can kind of ignore the first one and go with this one instead. Apologies to those of you who tuned in about 8 minutes ago to the other one. And let's maybe restart with introductions. We were just introducing ourselves anyway and talked a little bit to you after that about kind of why we're having this talk today on managing back to school fears and anxiety. I guess I will start.
Yes, who is Jill?
Who is, I'm Jill, this is Lina. I'm Dr. Jill Ehrenreich-May. I'm an associate professor here in the Department of Psychology at the University of Miami. And I run a research clinic here in the Department of Psychology on the Coral Gables campus called the Child and Adolescent Mood and Anxiety Treatment Program. We have been around here for about 10 minutes, 10 years.
It feels like 10 minutes.
It feels like 10 minutes. It went really fast. For about 10 years. And during that time, we have really focused our research on trying to better understand what treatments work for fear and anxiety and depression, or what we might call emotional disorders in children and adolescents. And all of the kids who come and get services through us are participating in some level of research study. So there's a combination of what we're doing of kind of research and service. And we see kids all really through the age range of about 4 or 5 up through 18. So maybe, Lina, you could tell us a little bit about what you do and the wonderful person you are. Oh, and I forgot to mention before we do that is that I'm also a parent of some children who are 5 and 8 years old, some of whom have some fear or transitional issues back to school as well.
Perfect. That's the most important line in our resumes, right? Yeah. I'm also a mother. I will start there. I am a mother of a 10 and a 13-year-old. Hi, I have entered the adolescent phase. Yeah. I'm gonna. Sorry. Yeah. Well, yeah. Anyway, so I'm Lina Acosta Sandaal. I am the owner and founder of Stop Parenting Alone. Stop Parenting Alone is a parenting and psychotherapy center here in Miami, Florida. And everything we do at our center is based on our belief that with the right information, parents always make the right choices for their children. And it was a program that I started with the idea that, yes, we can do intervention. We can help children when they hit the bumps, and we can help families when they hit the bumps, but we're also about prevention. And the way that we do that is through parenting classes, through an online parenting support subscription, and it's just getting the information to you that a building like the psychology department at the University of Miami has. But I like to tell parents this information because at the end of the day, they hand you a baby and they wish you luck, but they don't give you all the information that you and I may have because we have a master's in clinical psychology or child development or family systems. But I opened Stop Parenting Alone thinking parents need this information. So that's my little background. And again, I'm a mama too. So wait, we did something when we didn't have audio that wasn't really important. And it was like, okay, it's July 27th.
Oh, yes.
Why are we talking about back to school?
Right. And I think that's a really, really great question. I mean, it does maybe feel a little early. We're, 3 or 4 weeks here in Florida, in Miami-Dade County anyway, of starting public school. And so I was saying, earlier that I almost feel like this needs to kind of still avoid the topic myself, even though we're doing this and we're talking about this here live with you. When we see these kind of like back to school sales at Target or wherever else, I'm like, oh, why do we have to buy this stuff now? Like it just feels way, way, way too soon. And yet, many of our kids might be seeing these triggers or seeing this information, on TV or elsewhere, and really actually anticipating that this might be difficult for them.
It's true. And it's important because, one thing that helps us manage the fears that pop in our mind is information. we all do it. Adults do it naturally, right? You have a new job, and you start kind of telling yourself a story about what you're going to do when you get to the new job, right? Maybe you're going to buy yourself a new mug or something like that. So why talk about it ahead of time, or at least not so much talk about it because it depends on the age group. Like a little tiny 3-year-old does not need to know that they're going to preschool today, but you need to know.
Yes.
What are you sharing? What are you doing? How are you being around your small child?
Yeah.
Thinking ahead of time, and a month is good time. So yes,
a month is good time, and particularly if you have noticed in the past that your child has had some difficulty with some of these transitions, whether that is to school or whether it's in other situations. We know that, kids develop and they change, and sometimes if we were feeling, fear or worry or anxiety about last year, it doesn't necessarily mean that we're going to be feeling it this year or we're going to be experiencing it this year, but it could be a good time for you as a parent to if you've had that experience with your child before, to notice, are there some indications that perhaps they're having this experience, at the present time.
It's true. So we thought that we'd start with like little stories, because as clinicians, we have lots of stories to kind of give an example of what we see that happens with children. Yeah. So Jill,
yes,
tell us a story.
Tell you a story.
A little anecdote about what anxiety can look like.
I'm just going to tell you that my kids I ask me every night to tell them a story before they go to bed, and I freeze up. I keep telling them the same story on the day you were born. Literally, I have no other story. So I'm not going to tell you about the day that they were born. But I do want to tell you a little bit about the kinds of kids that we often see here who are experiencing these kinds of things. And I can tell you that anecdotally, a lot of the kids that are having concerns at this time point that are coming in are having things like fears about separation from their parent. They may be having some worry about, bullying or social concerns that maybe they've had in the past, and they're anticipating in a new situation or a different situation or a different grade, or different teachers, could be difficult for them. A lot of the kids we work with here are just really general worriers. They are the kids that are thinking about it and thinking about it and thinking about it. And you may not even know that they are thinking about it and thinking about it and thinking about it, but they're, it may be like keeping them up at night. It may be, keeping them from doing, things in a way that would seem more proactive, like getting materials ready for school or finishing that summer reading. I mean, look, not every kid is going to want to do that, regardless. Doesn't mean they're anxious. But I do think that a lot of the kids that we see here are really fundamentally avoiding, in some way, shape, or form, the kinds of things that bother them about being in school or we're anticipating are going to be happening during school. Right. So now I feel like you're going to tell a better story because you're a really good storyteller. So it's like a build-up. It's a build-up. So now Lina's going to tell you an actual story.
Jill is feeling fear. Well, I want to piggyback on what you said, because a lot of the time a parent will come to our space and I will tell them, no, you need to see Jill. But they will come to my space because the child is saying that school is boring, right? And anybody under 8 that's saying that school is boring, that's very unusual.
Right.
An adolescent will tell you school is boring. That's pretty normal.
Right.
But under 8-year-olds really want to learn. They really want to be good. And when they tell you that it's boring, you should back up a little bit.
Right.
A lot of worriers will tell you that they don't care. They don't care that you're going to punish them. They don't care. Both of these things are like typical day-to-day avoidant behavior, right? I don't care that you're going to punish me, because to them it's like, listen, I'd rather you scream at me than me have to go through this fear of going back to school because my mind is telling me that I'm in a life and death situation. Because that's the tricky thing about anxiety, when it's truly clinical, is that their body is telling them that they're in physical danger, like life and death. Like all of us in a car, somebody cuts us off and we're like, right? And we, everybody, when that happens, you got to don't you turn on the radio?
A distraction.
Right? Because all of a sudden all of our senses are like on fire,
Mm-hmm.
and we have to turn down the radio. So I would say that for a lot of parents, they don't know that they're worrying, but your children are doing these things. They're telling you they don't care. They're telling you the school is boring. They're telling you that you're mean and you don't understand them and you don't know what you're talking about. Primarily because you're asking them to do the thing that they're afraid of. Now, my little anecdotes are for the younger parents, right? What I see a lot of is I will get a call inevitably, multiple calls inevitably in September with little tiny preschoolers screaming bloody murder in the car on the way to preschool. And that's kind of like back to school anxiety for the little ones. And what I find is that it has been a mistake that a parent has made. So sometimes when parents drop off children at the preschool, these are the two primary mistakes, and these are like my personal anecdotes. So one, you stay in the classroom way too long. You stay and you stay and you stay and you lurk. You look through the window and you sit down, and the teacher's like trying to like nicely kind of walk you out with her body. And when you do that, the message to your baby is you're not safe. So all of you mamas out there that are taking your little itty bitty ones to preschool, please, the message that you must give your baby with your body, your energy, and your voice is you're safe, and this is the beautiful caregiver that I've chosen for you. You pass the baton is your child, right? So staying too long in a classroom is not appropriate. Now, there are beautiful preschools in this city that in the first 3 days, they let you be in the classroom. What you must do in that time is not sit next to them and go, it's okay, it's okay, it's okay. It's to tell them, you're safe, baby. I know that it feels yucky, but you're safe. Or some version of it, that's what I would say. Make it your own. And then the other thing that parents do, I need to take a breath because I dislike this one a lot, is that you disappear. You hand over the child and then boom, you're gone. Right? You don't say goodbye, you just disappear. So guess what?
You drop and run.
Yes. The next time you drop off your child at preschool, guess what your child is going to do? They're going to hold on to your leg. They're never going to lose sight of you.
Right.
Because whenever you take them to this place, their person that they love the most, the person that keeps them safe, disappears. And, why you're doing that is because you're avoiding your own feelings,
Absolutely.
your pain of your baby being sad. And I think that these are like the precursors of anxiety.
Absolutely.
You're laying this foundation of mommy doesn't mean what she says when she tells me that I'm safe.
And I think I think what you're talking about is just so important, because yes, it happens, perhaps most acutely in the preschool environment. That sort of separation distress is really normal during that time. And so we all feel guilty and sad, when we see it and feel like, oh, maybe I should be staying here longer, right? Other parents are staying, and so I think that there's that normal kind of sense of this feels really uncomfortable, that I am playing a role in perhaps making my child feel sadder or more distressed in that moment. And while that is something that happens a lot within that preschool environment, I think it's really important that clinically we see that same pattern continuing to happen with kids who are anxious, about this kind of worry or about other related fears, going much further up in the age range into adolescence, where it kind of becomes this habit where you are kind of stepping in and out of, as you mentioned, kind of your own distress to a certain extent, or worry that your child is gonna be upset in this particular situation, and either trying to make the situation easier for them, which, in some cases is appropriate to a certain extent. If you're, trying to work on sort of slowly transitioning them, you're taking steps forward, that might be a sort of a good way to approach a situation, not necessarily to avoid it. But in other cases, somebody might be stepping in way too much into a situation, or helping their child avoid or escape altogether when they see that stress. And we see that behavior really up through the teenage years. and even honestly, a big area of research right now is also into what they call emerging adulthood, which is these kids kind of transitioning to college and they can't manage. They don't, they don't know how to, or they've never had to negotiate a new transition to a new school environment kind of by themselves. And so they're really lost emotionally about how to cope with the kinds of maybe more typical stressors. And again, that is a typically stressful situation for many kids and growing up. But I think once again, we're noticing, or we need to notice kind of when we feel that discomfort, and not just when we're noticing our child sort of worried or fearful or uncomfortable about sort of this transition back to school.
And I think what's important to keep in mind as a parent, and reason 585 why parenting is so difficult. When we have an infant, we are supposed to soothe that infant every single time. That builds a secure attachment, right? However, when we move through the trajectory of development, as parents, we also become the reason why they get frustrated. We also become the reason why they are afraid, right? Because we're leaving them with a stranger when, every child would, any child under 6 just wants to be with you 100% of the time and suck the life force out of you. That's what they want to do. That's their goal. I know, that's what it feels like.
I've never had this experience.
But you have to understand that as parents, we are teaching children how to manage their emotional world. And we must learn to deal with fear. We must learn to deal with frustration. And we must learn to delay gratification. And this is done in those moments when you hand your baby screaming to the preschool teacher and tell your baby, it is sad that mommy's leaving, but you're safe. Because what I always tell parents is your parenting goal can never be for your child to be happy. Take that off the list. Parenting goal needs to be that your child is healthy, emotionally and physically, and safe, emotionally and physically. And sometimes for us to have that goal as a parent, we must let them feel fear, frustration, and disappointment, right? Why are emerging adults in college campuses not finishing their first year of college? Because they lose their manager, right? Mom and dad have been managing all their frustration, all their disappointment, and you never let them fail. And then when they fail alone, they think that they're doing something wrong because the message has been, you're supposed to be happy. We're addicted to happiness as a community, and we need to stop that.
And, I think that, a lot of what you're saying is, resonates so strongly, even for the kinds of kids that we end up seeing coming in for treatment, as well. Again, these are parenting experiences that happen whether your child is having just, kind of a momentary, just a week or two or a couple of days of distress about going back to school, which would be really typical, especially in the days kind of like leading right up to when school starts. That sort of discomfort kind of going up would be really typical. But we also see those things, kind of fade away a little bit right into the beginning of school for those kids as well, kind of where they sort of are adjusting more typically. And then we have kids that we end up working with more clinically, which, I think every year, unfortunately, happens where we get a lot of phone calls, 2 weeks into school where people are saying, my kid is not adjusting the way that I had sort of expected. They were having these fears, they were having these worries, but it just didn't resolve the way that we sort of had anticipated it to. And we don't know what else to do. And they're finding themselves doing a lot of what, we call a sort of emotional behaviors, both from the child side and the parent side. So again, some of that might be some of that avoidance in terms or escape behaviors, or just, and that could be like calling you a lot, from school. We've had, kids
texting.
Oh my God, the cell phones. And don't even get me started on the cell phones. Kids with anxiety, just as my one tip for the day. Kids with anxiety really, don't always manage their cell phone in the way that you're anticipating it to happen, and can really struggle a little bit with contacting you a lot. And some of what we end up doing there is just helping parents to kind of know how to respond, where they're not sort of falling into what we might call these emotional parenting behaviors of sort of saying all the time, it's going to be fine, or you should go talk to this teacher about X, Y, or Z, and sort of again managing that situation for them, whether that's helping them to escape or avoid, or telling them what to do.
Right.
Right there in that moment.
It's true. So we've talked about the problem.
We have.
So let's talk about the solution. So here you have, me, who's more of a prevention head, and here you have Jill, who has research and is really figuring out the best way to intervene with children, hence the research here at the university. We're trying to find the way, which is nice. I like it, So we have, let's tackle that. What would you think are your tips, your takeaways right away of like, okay, you have a 10, a 12, a 22-year-old that is just telling you, no school, forget it.
Yeah, well, I mean, that can obviously be a really big challenge if they're immediately saying, forget it. Then we sort of get into, well, you probably need some assistance with that. But I do think that, very kind of first and foremost is to listen. At the very sort of core of things, I was talking about these emotional parenting behaviors, and I think what happens very frequently is that you as a parent sort of hear that, I'm not going to go to school, I'm not going to deal with this, I'm not even talking, and you react by panicking a bit. You have that same fight or flight kind of response in your own body, like, we have to take care of this right now, like this very, very second, and end up kind of maybe not listening as effectively as we would sort of hope that you could during those situations. So for example, I think that it's really important to just empathize and to try to label what you're hearing, even if, that can be a little agitating from time to time, but just, say, okay, I'm hearing that you might be really worried about what's coming up, in school. Can you, maybe tell me a little bit more about that? And try to be, as much as you can, label those emotion words, and don't just jump right away to problem solving.
No, and that Positos just asked a question, which is exactly what you're talking about. She writes, my daughter, who is 9, since she was 4, every summer towards the end, her anxiety goes through the roof. She says she doesn't want to return to school, and she is afraid and has cried every day. So first and foremost, I want to say to you that, ow, right? Because the last thing, I don't know what to say. So it's exactly what Jill just said, right? We want to fix it, because as that's the parenting role, right? Ta-da-da, I will protect and take care of you and make you happy. And I think what you're asking everyone to do is like, no, actually don't fix it. That's not the first line of action. The first line of action is to say, I know, baby. Like for you, with your daughter who's already scared and she's right on time, so she's normal. We're letting you know that it's a month ahead, and she sees the back to school commercials. Say to her, you're really, really scared. I can see it in your face. I can see it in your body. Let's talk about what you're scared about, right? And that's what you're saying. That's like the first line of action.
Yeah, and I think that for Positos, who also is sort of identifying that her child has experienced a lot of selective mutism in the past, that fear about talking to new people, a new teacher, new kids in the classroom, that can be a really, really challenging thing for kids who have had that feeling. Selective mutism, oftentimes, kids feel like almost like their voice is kind of frozen in those environments, and they may be very interactive and playful at home, and then in the school or with other caregivers sometimes not be able to, or feel like they can't speak at all. And so, the advice there, it's a challenging problem, and I'm sure you've been dealing with it for quite a while now. But I think that the principles of what you do, when you're dealing with that kind of situation, after you have kind of listened and tried to kind of keep yourself calm and not jump right into problem solving, is about trying to identify an action plan that really involves sort of approaching and kind of utilizing what we might call exposure principles to engage with that school setting, sometimes in advance if you can arrange it, so that there is this ability to kind of get used to, when we do exposure therapy here in this clinic, a lot of times the goal is to kind of get bored of the thing that you're afraid of, right? So in some ways we want kids to also sort of, we don't necessarily want to get bored at school, but we do want them to get kind of bored of some of these triggers, whether that's somebody new speaking to them, or like RMCP is saying, fears about sort of feeling crowded in the hallway and sort of those kind of panic that can be like oftentimes like panicky sensations that they're having in their body. A lot of times what we do treatment-wise is really give them some time to adjust to these triggers and situations, in a gradual but approach-oriented way. Like we are dealing with this, we have maybe some backups, but our backup is not, we don't go to school.
And I would, in this idea of listening and exposing them to what they're afraid of, that we as parents know is really not something that's dangerous, right? Mm-hmm. And sometimes when you tell me what you're worried about, sometimes we hear things that are like, oh wow, that is very, very valid, right? So if you skip to fixing it, you may miss something that has happened at school that has caused your child to not feel safe anymore, right? And then you miss the opportunity to assist your child. So I would say that within this listening and this exposure time, something that I love to do with parents, and I tend to do this in session with parents, I sit with the child and I say, okay, this is going to be a really, really, really yucky, scary moment. You ready? What do we need to do? And then like in my office, there's lots of teddy bears and stuff, and I put stuff around them because I see very young children. And then I tell them, okay, let's listen to fear. What is fear saying, right? And in the adult version of that is like, what's the worst case scenario, right? And I slowly walk them through that, but I think that like kind of walking through their worst case scenario.
Right.
And by the way, you can't do that in the middle of them crying and telling you that you're a mean mommy for telling them to go to school.
That's a really, really good point, Lina.
You can't. When they're screaming at you, telling you that you're a mean mommy and they don't want to go to school, my recommendation is just to touch and hug them and tell them, okay, you're really, really scared. And once they're settled, right, that's when you can go, okay, let's play out what fear is telling you. Because when you do that, then you can actually say, oh, so you don't like it when Miss Sanchez gives you the face. Right? And then you can tell the child, well, Miss Sanchez maybe is making the face because her tummy hurts. Or Miss Sanchez is making the face because the classroom is getting really, really loud. Or Miss Sanchez is making the face because you made a mistake. Right? Because if you're anxious, any unusual face will look dangerous.
Those are all really, really good points. And, sometimes I will tell parents, think about when you are having an argument, with your significant other. Are you always logical? I know I am, but I don't know about everybody else. Frankly, when the emotion is hot, so to speak, our logical thinking doesn't really go so well, generally speaking. And so, we really try to, as Lina's suggesting, kind of either anticipate kind of as you're going into a situation or sort of slightly ahead. Doesn't have to be 4 weeks ahead, but, it could be just, as you're driving somewhere, kind of, if you sort of, you see that there's some anticipatory anxiety about this situation, walk through what is fear telling you here, and this is a good time to kind of come up with, well, what are some other things that could be true about that situation? Or you could wait and do it afterwards. In the middle of feeling that way, when you see them kind of really super distressed, I think that, what we're wanting them to do is just try to allow themselves to have that experience. There's nothing wrong with having fear. Fear is actually the, one the innate kind of emotion, if you will. It's the thing that protects us in truly dangerous situations. We're not trying to eliminate, or extinguish all fear, and that's not even really, it's not possible. But what we're trying to do is notice, particularly when somebody's having a lot of fear, a lot of worry, a lot of anticipatory concerns, or really intense kinds of experiences of those emotions, is it's not so much the emotion itself that we're trying to kind of get rid of. It's the reaction to that emotion that sometimes is getting us into a place that is either less helpful or actually kind of unintentionally makes the emotion more intense or strong. So like the more we avoid, the more we escape from some of these situations, the more that actually we may, next time we go into that situation, feel that intense feeling of fear and anxiety and worry. So, if I were to kind of like go back for a second to what we were talking about earlier, where parents can sometimes jump in too quickly and sort of rescue their child from that situation. Why is that a problem? Well, it's a problem because it ends up, at the end of the day, really potentially making the anxiety stronger. We've sort of, as Lina points out, sent this message that this is a dangerous situation. And instead, what we want to do is listen effectively and kind of help them to approach the situation with them.
And I want to address something directly to Posito's question, where you're saying, I don't know what to say to make her feel better. I want to change your goal. The goal is not for her not to feel the fear. The goal is for her to manage the fear. So we literally have to tell our very logical school-age children, baby, this is only going to get better when we start doing it differently. And what I mean by that is that right now, both of you that have asked us your questions, your son that's afraid of crowded hallways and lots of people, and Posito's child that is afraid of going back to school, her brain is telling her, don't go there. That's the worst place on earth. You're so dangerous, right? And she's practicing that, right? And because the brain is a muscle, and when we repeat, it gets bigger, right? So I would say to you that we have to tell our babies, hey, being brave, to be brave, we have to be brave and afraid at the same time, so that then we can be brave and proud once we've done it. You only feel better after you do what you're afraid of.
That's right. And to jump on that point, I mean, it's not even so much that we feel better. I think that one of the great things about doing anxiety-focused work with kids, the thing that perhaps that I love the most, is that when people are successful at sort of either re-engaging with the situation that they were avoiding and kind of saying, hey, this wasn't so bad, I thought it was a lot worse than it really was.
Yes, always.
The victory that they feel is so palpable, and also the sense that, hey, this is kind of like a life skill. This idea of I can approach something versus avoiding it, when something is difficult. I wanted to also follow up a little bit, but both Positos and Vivian kind of have a similar question in some ways, about sort of this kind of in the middle of having, we sort of talked about this a little bit a few moments ago, in the middle of having a strong emotion, that kids can either become very difficult, very unmanageable, have big tantrums, or they just really have those strong escape urges. Like that's when they're calling you, from school and saying, hey, I want to be picked up, and you may or may not be able to do that, or you may not be able to sort of intervene in that moment when it's effective. Especially thinking, maybe you could address sort of that tantrum piece of it, and sort of how you kind of like go about addressing when you see that kind of like anxiety-related tantrum.
Right. So in the younger kids, I always say this is a foundation, right? That then becomes bigger and more communicated and true body responses, like Posito's describing. Like Posito's describing her child basically having a panic attack. So Posito, you are now in the space where your child's stress response has become physical, and that's important to manage. But for Vivian's question, it was about this idea that at a preschool, some children that don't have working mamas get picked up in the middle of the day. And then if your little person, kind of leans on anxious and they see the other parents coming to pick up their friends, they get anxious, and then the rest of the afternoon is just bad for them because they're constantly checking the door to see when mommy's coming. Now, a lot of parents in the preschool ages will set themselves up for failure because they feel bad that they're a working mama.
Yeah.
And they will come in the middle of the day every once in a while. Please don't do that. Okay? The inconsistency at drop-off and at pickup in the preschool years will create a sense of anxiety for your baby. Your baby needs to know that no matter what, mommy comes after nap time while they're in the playground after, at the end of the day. If you have come early because you feel bad, because you're a working parent, now you have made your child wonder, is my mommy coming today in the middle of the day? Is my mommy coming today in the middle of the day? So don't do it at all. If you get out early because it's the summer months and your job is awesome and they let you out early, please go get a massage, get a mani-pedi, fill yourself up, give yourself the mask like the airline tells you, but always drop off and pick up your preschooler at the same time, because your babies cannot tell time, but they can tell the flow and the pattern of their routine, right? So where parents make the mistake is showing up early or not showing up consistently for pickup.
And I think, it's a huge problem in the preschool age group, and I think also sometimes with camps over the summer, these half-day camps, and if you're, I'm always, I don't think I've ever signed my child up for a half-day camp. They're always the full-day camper because I'm working, and so and then sometimes I'll hear it later, well, why can't I get picked up right after lunch? I don't want to stay here, into the afternoon. And then you do have that guilt sort of, and feel like, all right, well, maybe I should be kind of coming at least when I can, to pick them up. And that inconsistency, being such a huge issue, but it is an issue that even sort of extends into the school age years, into adolescence. A lot of times that, again, that pull that you have as a parent to kind of sort of jump in out of feeling your own sort of guilt or shame or difficulty with the idea that your child might be upset in this situation. One of the things we work on in treatment very, oftentimes is just how do you be more consistent in general around these behaviors, because they're sometimes going to look different. It might be sometimes that they're just not sleeping very well, or they feel like they're having some stomach aches, or that they might actually tell you that they're upset and worried. It could look very, very different, and it almost pulls for inconsistency.
100%.
Yeah.
100%.
It pulls for that jackpot of, okay, mommy, let me stay home. Or now I don't have to, I'm just going to, do my classes, online today, or whatever it might be. So I think that this issue is really one that actually extends, quite a bit over as well.
Because you have to think about, anxiety tells us that when we don't know what's going to happen, when something is uncertain, it's dangerous, right? So as a parent, when we're guiding a child through their fear and their anxiety, I always ask a parent, look at your routine. A lot of it needs to be rigid because your child is currently going to be exposed to just regular life on life terms, uncertainty. So please don't become one of those things. And sometimes it is about you inconsistently responding to them. And be gentle with yourself, because it's really, really hard sometimes, especially when it's gotten out of hand. Because sometimes we, in our response to our children, we may be mean. Stop it! I already told you, nothing's gonna happen, right? That is an inconsistent response, right? Because sometimes you love me and you hug me and you let me stay home and we eat marshmallows, but sometimes you scream at me. Right? So choose your response. And again, we are telling you a little bit of what the response needs to be. Listen, give them facts about, yes, this can be scary, and you're right. When somebody's saying mean words to you in the classroom, that can be scary. So let's talk to you to the school. And hey, there's nothing dangerous about the discomfort that you're feeling about going to kindergarten. That's normal, right? I always like to tell my clients what's human and when's your fear lying to you.
Absolutely.
You know,
it's a trickster.
Yeah. Oh, it's fear trickster. Yeah. So I want to also talk about prevention.
Okay.
Because a lot of the time, we don't think about this, and then we'll get back to some of the questions.
Mm-hmm.
Sleep. Sleep. So many kids are not sleeping. It depends on the age group, but sleep is really, really important, and it is brain health.
And I don't know about you, but my kids get way out of their sleep routine over the summer.
Mm-hmm.
And so,
Yep.
And I'm like, I'm already thinking about it. It's like, now we're going to sleep sometimes like an hour and a half later than we normally do, waking up later, and we're going to have to, kind of suddenly change back. So some of that irritability you might see kind of, is sometimes a lot of that change in sleep routine as well.
Yeah, and you have to make sure that your little kiddos are sleeping, and the very young ones, they under 5, they need between 10 and 12 hours of sleep in a 24-hour period, right? And adolescents do too, but there's not an adolescent in the world that gets that kind of sleep except on Saturday. And then the school-age children, it's anywhere between 7 and 9 hours in a 24-hour, so that's important. And then eating, like sometimes they don't eat, or what they are eating is not necessarily as healthy. So I always recommend parents when they're having big, large, challenging behavior with their children, or there's a lot of mood shifts, to go see a nutritionist and to kind of take a look at your diet, because we are mind body. We're not. And mental health is health.
Right.
And then there's tons and tons and tons and tons of literature on mindfulness and mindful meditation. And it's so popular now, it's so popular that it's annoying me.
Right.
But we do know that it does help with anxiety and with ADHD. And what I like to tell parents is like, mindfulness is just about being right here, right? So and I like to tell parents, do it as a family. Put your phones away and have mindful eating, right? Tell the child, hey, let's chew 20 times and see what it feels like in our mouth, right? And that's mindful eating, like give each other a mindful hug. I'm gonna hug you, and what do your fingers feel like when I hug you? What is your, thing? And that becomes a moment for you and for baby, right?
And just to kind of jump on that point about sort of mindfulness and awareness skills, when we're kind of taking it into that environment of somebody who's feeling a lot of fear and sort of anxiety and worry in particular, a lot of, in our treatment and unified protocol that we utilize and sort of do research on here in our research program at UM, one of the things that it talks about is this idea of anchoring in the present. And that notion is really kind of, focusing in on the breath and just noticing what is going on around us. And is this something that is really kind of aligning with the reality, is what I'm thinking, aligning with the reality of this moment, or just doing a very basic kind of body scan to kind of notice that I might be feeling really tense in my body right now. Sometimes some just very simple kind of awareness skills are really useful in those moments when that, like we were talking about earlier, when the emotion is really hot. Yes. To try to kind of, bring us back to the here and now. And the here and now is often not as dangerous as we're sort of thinking it is in our minds. And so that sort of strategy of kind of anchoring back to the present is to help reinforce that.
And one of you that are watching RM, you're talking about your child having a hard time at night.
Mm-hmm.
If a child leans on anxious, at nighttime is the worst time because everything is quiet and then the thoughts go off in their mind. So you just said body scan. I love bedtime body scans.
Mm-hmm.
You lay with them, and then depending on their age, if they're adolescents, you can do an app like Calm or Insight Timer, and you can teach them to do a guided body scan meditation before they go to bed. And if they're young children, you say, okay, let's say goodnight toes, goodnight heels, and you tell them that they're putting their body to sleep, right? And a body scan at bedtime can be amazing, or putting a stuffed animal on their stomach so that they can concentrate on bringing that teddy bear up and down, but then that's a breath meditation. And then with the little ones, bubbles.
Oh, yeah.
So you teach them to breathe in.
Mm-hmm.
Okay, now you have to blow through the bubbles for at least 5 times or 6 until I count to 5, and then that teaches them that breath. And I think that these are preventive measures, but also I do want to say, because I think it's important here are to clinicians and professionals. If there are physical aspects like heart palpitations and sweating and rigidity in the body and insomnia, like you're describing, I would recommend getting an evaluation. Wouldn't you?
I would as well. And sometimes it's helpful if there are a lot of really intense sleep concerns to kind of get an evaluation for that as well. Sometimes there is an independent sleep issue that's not just worry. Oftentimes it is. But it's sometimes worth kind of checking with your pediatrician to see if maybe another also sleep referral in addition to an evaluation for treatment services would be useful. One thing I want to add, I mean, those were such good strategies, and I think that they really apply to both the prevention context and the context of kids who might need more clinical help. One thing that I do want to make sure we talk about is, okay, you've talked to your child, you have empathized with them, you have identified that they're feeling fear. We've talked about a number of strategies, things that you can do to sort of help assist them. At the end of the day, of course, a lot of parents are still struggling with how do we approach that situation versus avoid it. How do we engage with it when they are distressed? And I think that, fundamentally, one thing that is really important is that, even when we treat kids who have very significant clinical fears, we don't just throw them, in their entire body into the situation. That's not always possible to avoid doing with school. So it is going to be an intense experience for them. But what we can do is sort of break it down into some what we might call baby steps or smaller pieces to try to approach it as much as we can gradually, or approach the things about the situation in small parts, or practice some of these things. If it's fears about talking to new kids or talking to teachers, you can practice some of those things at home or with, when you go to a restaurant or when you go to other places where there might be peers or other adults to kind of practice some of these skills. So think about, in some ways, parents of kids who have a lot of anxiety, often end up having to live what might call the exposure lifestyle, where everything is a sort of potential opportunity to reinforce this idea of how do you approach this particular situation? How do you let yourself feel the discomfort of that and still continue on into it? So there are two really big important pieces there. One is kind of breaking it down into smaller steps. Yeah. The other is to feel the discomfort while engaging in those steps. And as a parent, not jumping in when you see the distress that comes with that, of sort of pulling them back, automatically. Believe me, I've worked with a lot of anxious kids over time. They will pull themselves back. You don't do it for them. Your job is really to encourage, reinforce, and remind where you need to that this is not a dangerous situation.
Right. So again, parenting goal can't be happy.
Mm-hmm.
Parenting goal can't be no fear. Parenting goal is health and safety, emotional and physical.
Yeah.
That's it. That's all we have to do. And sometimes when we do that, the child doesn't like what we're telling them to do, like brush their teeth. So let's talk about what's in the big world community, macro, everybody talking about now that we're heading back to school, this whole idea of school shootings, right? Just recently in the Miami Herald, I was reading an article about how the school board is responding to it by increasing their police force. Right. So again, that's the school district, the Miami-Dade County School District, doing their part. What they find important to manage this. But I think now it's our turn to do for all of you parents that are watching this or who will watch this, to talk about, okay, this whole idea of this community fear that all of a sudden, schools are not safe for our children. So, I think that with this idea, I'm going to say something harsh. You ready? So, facts, right? We're talking about, okay, first I'm going to hold everybody that's watching this. I said school shooting, and your heart probably started, pumping, or you got tense in your body. And this idea, is it a human response or anxiety? That's a human response. Just the thought makes us all feel really uncomfortable, right? But let's do a fact. A lot of you guys put your 10-year-olds in the front seat. There's a higher possibility that you're going to get into a car accident with your 10-year-old in the front seat. Please don't put 10-year-olds in the front seat. I'm going to take an opportunity right now to tell all of you that it's not safe, right? But there's a higher possibility of having a car accident versus a school shooting. And that's a fact. And a lot of the time we've been, we have a lot of social media and communication that makes this school shooting thing be like it's an epidemic. But let's be factual about this idea. So take care of the car safety, right? And that's something that you want to do. But I really want to just kind of think about that. And the other idea of, as it pertains to school shooting, why it's so scary is because there's really not much we can say to our children about them being safe, right? It's an unknown, what we were talking about before, right? It's this uncertainty. But what we can do as it pertains to a school shooting, and if it comes up, is talk about the motivations for why people, may do something harmful, right? It's a nice conversation with over 8-year-olds, I would say, on, well, what do you think would cause somebody to be in so much pain that they would want to cause so much harm? Because that was a conversation I had with my 10 and my 13-year-old. I was like, well, let's think about it, and of course you're not going to do this extreme, right? But, I think that if we can talk to our children about the motivations of why somebody would make such a negative decision, can be very, very helpful.
It can be helpful. And I think that, we know that there's documentation that anxiety and fear are on the rise in our youth. I mean, I used to get asked that question a lot, and I'd be like, no, anxiety is kind of normal and typical, and it happens to everybody, but there is really research evidence that it's happening more often. And we have to look at things like school safety fears and the degree to which, even though they are really rare events, that they are things that feel so vivid. And, recently for us, it's so close to home. I grew up in Coral Springs, and, very close to home, obviously. And to the degree to which it feels, like it could happen to you, there is going to be some level of concern or anticipation, and particularly our kiddos who have a history of fear and worry and anxiety. This has inevitably been something that they're identifying as a concern when they come in here clinically, as something that they are worried about. And I think going back to kind of our original points, I think the first thing that you want to do is just hear them. And I think Lina's points about sort of understanding that, these are pretty normal fears, particularly when it feels like these things are close to home. That sense of uncertainty, that's probably the hardest thing about just anxiety in general. Just
you don't like not knowing.
No, it's what makes it a hard emotion to cope with, is that wanting to be sure, wanting to know, and I certainly fall into the trap of kind of doing things to kind of make sure I know, what's going to happen. And yet the reality is neither we nor our kids can always anticipate, what's going to happen in these school situations. And so the most important thing here is to just really understand that this fear is typical, but it is unlikely. These are still extraordinarily rare events, thank goodness. And, to the degree to which we treat them as such smartly, I think that, that is helpful in terms of just coping. We're just talking about coping. for our kids is sort of still, managing within the reality of that situation.
And I would also say that as it pertains to, in particular, the subject of school shootings, for sure it's going to pick up in the news, right? And a lot of parents will tell me, well, my child doesn't know. My child is too young. My child doesn't understand. And, I was in a restaurant with my children, and in every single screen, right after Parkland, there it was, right? Yeah. So, again, same information that we were giving before about anxiety when it pertains to school shooting. Don't avoid the conversation. Be the source of information. Yeah. If your children are curious about a topic, they will find the answer. And I would much rather you be the source of information than Google.
What's really interesting.
Or YouTube.
Or YouTube.
Oh God, YouTube. Oh.
But one of the things that they know about sort of trauma that people experience after these kinds of shootings, not necessarily just the people who were there, has to do with the way that the news cycle is. This idea that you're hearing the same story over and over and over again on multiple screens in vivid, headlines and things blaring at you, on Twitter, on all kinds of sort of mechanisms for them to hear it again and again and again. And so when we're talking about kind of very typical fears and worries and anxieties, we're talking a lot about just approach. This is maybe one of those situations where you as a parent, I think what Lina said, be the source of information and try to limit exposure to when you have sort of this repetitious kind of news stories about it. And we might even think that there might be a number of news stories coming up about it, as people go into the new year. So just, keep an eye on what it is that they're seeing so that you can help steer the narrative in a way that it helps with coping and dealing with their distress.
And those of you that have children under 5, please be mindful of the television on everywhere. They do see it. They do pay attention. So turn them off. Like background television, the American Pediatric Association has given good suggestions of just turn it off. Like please don't have CNN in the background. Especially for children under 5. Yeah. You may think that they're not paying attention, but every once in a while they will look, they will see an image that they cannot process, and you are not going to know what they saw. So background television, it's part of screen hygiene, right? So just turn them off. And then I like to think about, Mr. Rogers. I've worked with little people, so I like the Mr. Rogers and Sesame Street. I get a lot of information from them. Still. Yeah. They taught me English when I moved to the United States, and now they help me in my work. That whole idea that Mr. Rogers used to say, look for the helpers, right? Yeah. So as it pertains to school shootings, I think in all age groups, why don't you figure out how to be the helper? How can you be of service in the community? How can you be part of the solution? Right. So with a lot of the teenagers in middle school and high school, they need community hours. So if they are thinking about the school shooting situation and it's something that it's top of mind, well, maybe join the community events that are around the prevention of this. And that's for the older kids. With the little ones, we can be like, okay, well, sometimes, somebody will make a really, really horrible choice when they're feeling really, really, really yucky. So, and then ask them, well, how can you be the helper? How can you be the person? And then kids have amazing ideas on how to help someone. They really do, especially the under 10-year-olds. Like I hear beautiful things. And then those of you that have young children, well, you be of service. You be the source. And since we're talking about a community thing, please, join organizations that you believe in. That you want to be the change in the world. Don't stay in the hopelessness of like, nothing's changing. Well, nothing changes if we don't do anything. And one person alone, like you smiling at your neighbor and saying, hey, how are you doing? Is something.
So Lina is such a wonderful role model. I think she's speaking about also things that she does, which I think I really admire. No, I really admire about you. We should probably also end by talking a little bit about the fact that we work together. We do. I mean, we don't work together in the same location, but we actually have been working together on a research study We have research studies that sort of operate just through that kind of child and adolescent mood and anxiety treatment program here at the University of Miami. We are also doing some research out in community settings like Stop Parenting Alone, and where we are treating in particular adolescents who are experiencing things like fear, worry, anxiety, obsessive compulsive symptoms, depression, all of these what we call emotional disorders. And we're looking at sort of differing treatments that we could be providing, one of which is a cognitive behavioral therapy approach that we developed called the Unified Protocol, which I mentioned earlier. And at Lina, at Stop Parenting Alone, we have this study where you could potentially receive that, as well as potentially other potentially effective therapies as well. And so, please feel free to kind of visit us on the web at www.miami.edu/child anxiety. It has information about what we call the COMET study, which is that adolescent study where you could be seen potentially at Stop Parenting Alone as one of the locations, or you can also read about some of our other research studies. And of course, I would be remiss if I didn't say that you should also visit stopparentingalone.com, which is Lina's wonderful website, really, and about all of both the therapy services that they provide there, but also just the wonderful parenting-related consultation and coaching that you do as well.
And if you love both of us and you call Stop Parenting Alone, you can say, hey, I heard about the work that you're doing with UM with teenagers. And we'll be like, yes, perfect.
That's right.
And so then you would be getting Jill and Lina at the same time. So there's in the comments at Stop Parenting Alone, I put a lot of, information and articles about what we've talked about today, just in general. So later on, if you show this video to a friend, because sharing is caring,
That's right.
you could also read what's in the comment section. And I think I want to repeat again, if your child is having actual physical responses like heart palpitations, sweating, rigidity in the body, insomnia, please, those are kind of clues that you need a bigger evaluation.
Yeah, absolutely. The great thing is, we do evaluations, Lina does evaluations. Sometimes people just kind of need to check in and say, is this really something, more significant in terms of fear and anxiety? Because the great thing, I guess it should end on a good thing about fear and anxiety. The good thing about fear and anxiety is that there are effective treatments that really do help. There's great documented evidence that these exposure-based therapies, cognitive behavioral therapy, is really one of, if not the most effective therapy for fear and anxiety. Mm-hmm. And just like I said, there's this wonderful thing about providing those exposure-based therapies where and you see that kids get better. So it is possible, and it does happen all the time in terms of kids getting better. So, yep. So thank you very much for joining us, and feel free to kind of do this video again and again and again here on the web. Forever and ever. Yes. On that note, okay. Bye.